immense logistical challenges. The virus has got to be stored at minus 70 degrees. Each person needs 2 injections 3 weeks apart. So it will inevitably take some months before all the most vulnerable are protected. Long, cold months. So it's all the more vital that as we celebrate this scientific achievement, we're not carried away with over-optimism or fall into the naive belief that the struggle is over. It's not. If you live in a Tier 3 area where community testing will be made available, please take part in that community testing. Together, these steps are, for now, the surest way to protect yourselves and those you love. And by reducing the transmission of the virus, help de-escalate your area to a lower level of restrictions as vaccines and testing, as I say, take an ever larger share of the burden.
So the initial tranche in December is going to enable us to get started, but the bulk of this vaccination programme, either through this vaccine or hopefully others as well that will join it, will take place in the period January through to March or April for the at-risk population. So the phasing of delivery, the way we will do it, is that next week around 50 hospital hubs across England will start offering the vaccine to the over 80s and to care home staff and others identified by the JCVI. Typically, they may be people who were already down to come into hospital next week for an outpatient appointment. So if you're going to be one of those people next week or in the weeks that follow, the hospital will get in touch with you. You don't need to do anything about it yourself. That will then be followed in the subsequent weeks with GP practices coming together in each area to operate local vaccination centres. And that will grow to over 1,000 places right across England where GPs will be in touch with their at-risk patients, inviting people to come forward for vaccination. And then as even more vaccine becomes available, finally, we will be able to switch on large vaccination centres across the country and indeed invite local community pharmacists, probably at the beginning of January, to begin to offer vaccination as well. So, in a nutshell, this is going to be a phased programme. We, the NHS, your GP or your hospital, the NHS will contact you if you are ready to be offered the vaccine.